In this video we're going to have a look at the deadlift series. Deadlift or hip hinging is an extremely important pattern in sport, whether it's over a ball in a scrum or flexing to hit a ball in hockey, but also in the gym it's very important for athletic development and capacity around the posterior chain and lumbopelvic control. If we have a look at Tommy carrying out the pattern as an assessment, we're looking for his ability as he lowers the bar to allow his hips to move posteriorly throughout range, and his ability to adapt and maintain a neutral lumbopelvic position through range, but most especially at the top position. Common errors we see is that as he returns, he adapts an anterior tilted position. So if you drop down and come back up through range there, Tommy, you see that in a bid to get extra hip extension, the chest rises and we collapse into anterior tilt. Also commonly we see a struggle to allow the hip to move backwards as we descend through range, meaning that rather than loading the posterior chain, that work comes into the lumbar spine, or alternatively the knees collapse forward, ending up more as a squat position than a hinge position. So ideally through range we're looking for the hip to move posteriorly throughout range and maintain a neutral lumbopelvic position at the top of range so we can get end range hip extension. This is particularly important for athletic groin pain, the ability to load the posterior hip, especially in that inner range hip extension position during toe off, and to avoid these anterior tilted positions that may preferentially load or recruit the muscles across the front of the pelvis. The entry-level exercise for the deadlift stream is the half rack deadlift. This allows us to work on a modified range of motion to improve control, but also in athletes who may have a compromised hip flexion range. The main coaching cues are to focus on maintaining a neutral lumbopelvic position through range, but also ensure that the hip is moving posteriorly throughout the descent. Common errors are to collapse into anterior tilt either through range or most especially at the top of range when trying to achieve full range hip extension, or alternatively not allowing the hips to move backwards and end up flexing or moving forward with the trunk, or allowing the knees to collapse forward on our descent, replicating more of a squat pattern than a hinge pattern as shown. The progression of the half rack deadlift can be to increase weight and lifting with greater intensity, or alternatively to lift through greater range by lifting to the floor as shown. This may be a challenge for some athletes with athletic groin pain who may have hip morphological changes due to femoroacetabular impingement. Therefore select a range that the athlete can control appropriately.